Every pregnant woman needs this information to protect her teeth during pregnancy. I'm Dr. Nkachidma and I'm a dentist, and I help improve your oral health literacy. Okay, so let's dive in. Okay, so the problem with pregnancy is that no matter how good your teeth has been all your life, or if they haven't been so good, it just gets worse. What happens here is that your teeth becomes dry, okay, and also the mouth becomes more acidic. Okay, and that's a very big problem for pregnant women, because what happens there is, the dryness of the mouth and then the acidity of the mouth makes the, plaque bacteria multiply very fast. Okay, it makes it multiply very fast, and then it results to, decay and damage of the teeth. Okay, so what I would advise is for every pregnant woman out there to take tiny little bit of xylitol, throughout the day. Okay, and how xylitol works is that, first of all, it makes the teeth very slimy for the bad bacteria not to adhere on the teeth. Okay, it also multiplies the good bacteria. Okay, and xylitol also stimulates saliva production. Okay, and I told you that the main problem is acidity of the mouth. So this xylitol would also help to improve the pH of the mouth, thereby making the mouth to be a good environment. Okay, so to be more alkaline. And not just that, some studies have been done, okay, some years back, and it shows that some pregnant women that took in xylitol, okay, when they put to bed, their babies had good teeth. And what happened is that those pregnant women, before birth, about 6 months, their oral hygiene, when it was checked, they noticed that there was no plaque bacteria seen in their saliva. Okay, and then whenever they kissed, when their babies were finally born, they kissed their babies, okay, obviously with the mouth. They realized that those babies eventually grew up with good teeth. Okay, and another study that was done in Malawi showed that women that had xylitol at bedtime, okay, they had a lesser risk of preterm birth. So you see, xylitol is very important. And how you take it, don't just go up in all xylitol all at once. You take it bit, right? And you can get the xylitol from toothpaste, from mints, from chewing gums, okay? So now, after every meal, you just take in a bit. If it's the gums, you can take in a bit, chew for about 10-15 minutes, and then you discard the gum, okay? And you also rest your mouth. When I say rest your mouth, no eating of anything, okay? No drinking of anything, no taking of soda, nothing. Just allow your mouth to rest for about 60 to 90 minutes, okay? So that the xylitol can properly function. Okay, so yes, that's it. So if you learned anything today, please type in xylitol in the comment section. Thank you so much.